Thank you very much, Mr. President. I wish to ask the Chief Minister what assessment or advice he sought from A, the Public Health Directorate, and B, the Medical Directorate to inform decisions regarding the development and implementation of the 5-stage borders plan, and how this has informed his strategy for communicating his policy to the public. Thank you, Mr. President.
Call on the Chief Minister to reply. Honourable Member for Middle, Mr. Quayle.
Thank you very much, Mr. President. The 5-stage borders framework was developed from a briefing paper submitted to the Council of Ministers in early June. A range of different areas were asked to provide input to the framework. This included medical professionals, the Director of Public Health, and other senior officers from across government. The plan has been continually reviewed in respect of the developments in the United Kingdom and informed by the data produced locally in respect of infection rates, local test and trace capacity and hospital capacity. Most recently, the Council of Ministers revisited the framework on the 1st of October to consider whether the current levels were appropriate. The communications policy is constantly reviewed and aims to provide clarity to on- and off-island residents in respect of the current restrictions at our borders. Thank you, Mr. President.
Supplementary question, Mr. Robertshaw.
Thank you, Mr. President, and I thank the Chief Minister for his reply. Could we therefore go a little bit more specific? What advice did he receive from the Public Health Directorate, A, when he first went into adopting the 7-day test regime, and what advice he received from the Public Health Directorate when he moved out of that regime? And the second question that I have, if I may, Mr. President, relating to the 5-stage border plan, relates to the fact that it was developed some time back now, and the concept of shielding does not appear in that plan. Could he tell us whether it's likely that shielding will soon play part of that plan, and will he communicate that to the public? Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. As I said to the just in for part 2 first, if I may, Mr. President, the Council of Ministers regularly reviews all the evidence and the data. Nothing is set in tablets of stone because things move fast. When we initially made the decision, for example, on the 7-day testing and then allowing people to move around the border, I think the infection rate in the United Kingdom was 70, 80 cases per 100,000, and I don't need to tell this Honourable House or Court where we are now with that. So things move quickly. We have discussions on a regular basis, and I know we have another paper coming for this Thursday for a full debate to review, Mr. President. Regarding the publishing of advice, I think, as the Honourable Member will know from his time as a Minister, Mr. President, the Council of Ministers and their advisers should be free to make policy in a safe space and to ensure that the integrity of the policy-making process is maintained. It is important that this process is not undermined, which may result in less robust or well-considered policy. Obviously, we share as much as we can with honourable members. We give briefings, and I'm more than happy to give members an update whenever we are making changes to advise them as to why. And if the honourable member would like to speak to any of the officers, more than happy to have a chat.
Mr. Robertshaw, supplementary.
Thank you, Mr. President. I appreciate the Chief Minister's sentiment, but the question with regard to the Director of Public Health was quite specific, and considering that Guernsey put their Director of Public Health front and centre in communicating with the public, why is it that we can't know what our Public Health Director is saying to you, the Council of Ministers?
Chief Minister.
Thank you, Mr. Speaker. I think we've had our Director of Public Health give talks to the public in general, giving their views on and interpretations of the problems that we are facing. That's something we've done, not recently, I admit, but it's something we have there. If the Director of Public Health is happy for information that they've given us to be shared, and I'm not breaking any rules, then I see no reason why I can't share it with the Honourable Member.
Honourable Member for Douglas East, Mrs. Barber.
Thank you, Mr President. The Chief Minister stated that Public Health were part of the group involved in developing the Borders framework, yet in an email that I received from the Director of Public Health relating specifically to Stage 4 of the Borders Plan, she stated that the Public Health Directorate was not asked to provide any assessment or advice to inform the decision regarding the Borders Plan. Could the Chief Minister confirm just how involved Public Health have been and are in developing our pandemic plans?
Chief Minister.
Thank you, Mr President. I would like the Honourable Member, if they want to share that statement, I'll have it looked into. The Director of Public Health sits in the, not in the chamber, but is online to discuss with the Council of Ministers along with the Director of Health and Social Care to give us an update and information and answer any questions we may have during the Council of Ministers meeting. So I'm highly surprised that the Director of Public Health should say that they've had no involvement when they actually sit in the Council of Ministers and live, I hasten to add, and give us advice. So it'd be interesting to see the information.
I have 8 supplementary questions on my list. I trust the subject will have been well aired by the time we get to the last one. Honourable Member for Council, Mrs Lord Brennan.
Thank you, Mr President. The Chief Minister mentions another paper for helping make decisions in terms of what will happen next to do with 7-day testing. Could he confirm what sort of information he would require such a paper or any other previous paper to contain for the Council of Ministers to make a decision? Thank you, Mr President.
Chief Minister.
Thank you, Mr President. I'm more than happy to share that information with the Honourable Member. Mr President, as set out in the Borders framework, the Council of Ministers considers a wide range of factors to help inform any of a change to the current framework and a level at which it believes will protect our people. And this includes infection rates elsewhere, the ability of our health service to cope with increased demand, and the potential economic impact of any change. And I would also like to point out that not only did, when we came up with our Borders framework, was it from a health point of view, workshops were led by the Department for Enterprise, and they were held on the 14th of April, on the 3rd of June, in which both the Silver Command groups and the clinical advisory groups were in attendance, which led to the combined input that formed part of the final plan recommended to the Council of Ministers on the 4th of June 2020.
Honourable Member for Council, Mr Henderson.
No, I don't wish to ask you.
Oh, I thought you had indicated. Honourable Member, Mrs Corlett.
Thank you, Mr President. I would just like to ask the Chief Minister if he could clarify the clinical reasons around the ending of the 7-day test. I agree that the 14-day gold standard approach is correct, providing it can be adhered to properly. Would he agree that this is actually extremely difficult for some people who are self-isolating at home with the rest of their family? What I'd like to ask is, are we missing something here? A negative result at 7 days still placed considerable restrictions on a person, but a positive test after 7 days, when isolating with your household, must be hugely beneficial for contact tracing and lessening the spread of the virus. If a positive result is picked up at 7 days, then the whole household isolates for the 14 days. But if the positive test is undetected because there's no ability to test, the rest of the household is in the community, unrestricted, and quite possibly spreading the virus to who knows how many other people.
Chief Minister.
Thank you, Mr President. I thank the Honourable Member for Douglas Central for her comments, because she raises exactly my concerns and why we are having a review of this policy on Thursday, why I've asked for a paper from our medics. If I can expand on her concerns. We initially moved to 7-day testing, Mr President, based on infection rates, etc., and capacity in the United Kingdom. Now, since then, sadly, the United Kingdom infection rate has gone significantly higher than it was when we moved to the 7-day testing, and it was felt that the gold standard is 14 days of isolation. That is the best standard, because if you allow people to be tested on day 7, you will catch the vast majority of people who have COVID. There's no denying that. But some will slip the net, a very small percentage. We think maybe about 6%. However, When you have a low infection rate, say of 40 cases per 100,000, then that mathematically is quite a low risk to the population of the Isle of Man, that they may spread, anyone who's had the test and then goes out would spread it in the community. However, when you get to a tenfold increase, Mr. President, of where we are now, then allowing people to go out of the household once they've had a negative test after 7 days means that the chances of them having been negative but then going on to shed and have COVID, that percentage increases. So we made a decision to move to the 14 days. Now, obviously, that begs the question, should we shut down the whole household? Should we continue testing on day 7, even if we're asking people to stay in for 14 days? And these are questions that the Council of Ministers is reviewing, given our concerns about the high infection increase throughout the United Kingdom, Mr. President.
Supplementary, Mr. Speaker.
Thank you, Mr. President. Three-part question, if I might. As part of the move to stage 4, people were allowed to go off the island and return and self-isolate. Now, according to the law, only those people who were returning had to self-isolate, not the whole household that they were returning into. It was guidance, but it wasn't the law. What medical advice was sought and given in respect of that from the Public Health Directorate and the Medical Directorate? Is the second part of the question, is the Chief Minister aware that I've been trying to get an answer to that question since the 30th of July, and that I haven't been able to get one despite contacting the Medical Director, and I've had a letter from the Chief Secretary about it? And thirdly, would he agree that whilst there is absolutely a right for a safe space for policy development, that once the policy is made, that excuse then falls away, and the advice and information that ministers have rested on at that point should be made public?
Chief Minister to reply.
Thank you, Mr. Speaker. So, Mr. President, and I thank the Honourable Member, Mr. Speaker, for his 3 points. I think it's, if we ask officers, and you've been a minister yourself of Home Affairs, if we ask officers to give us information that is detailed and maybe confidential, if they think that's then going to be shared all over the island, will they be as frank and honest with us in their views when giving us their best advice? Now, historically, the Council of Ministers has never shared papers with anyone. It remains confidential. That's not something I've implemented. That's something that was there in your time, Mr. Speaker. You've been asking for information since the 30th of July. I know nothing about that, but I'm more than happy if the Honourable Member would like to forward that email on to me, then I personally will look into it and ensure that you do get an answer to your first part, which was regarding whole households having to isolate. And I think in the early days we did ask whole households to isolate. We did amend it then to allow people to exercise if they weren't the person affected. And again, all this is based around risk. And the Council of Ministers does take on board advice from medics, but we also take on board advice from Department of Enterprise, the business community, and across government Home Affairs, to make sure that when we make a decision, we try to do our very best. And we're spinning a lot of plates, Mr. President, trying to get it right, and we continue to do our best. That's all we can do.
Honourable Member for Douglas South, Mrs. Christian.
Thank you, Mr. President. Would the Chief Minister confirm what our border strategy will be in reaction to A, the increasing number of areas in the UK, especially in the north, going to level 3, and B, should the UK go into a similar lockdown as Ireland are doing on midnight and Wednesday, and C, what will that possibly mean for our repatriation of Manx residents? Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. Obviously, the increase in infection rates has caused us great alarm, Mr. President, and I sincerely hope that our colleagues in the UK, our friends, especially our colleagues in the North West, are able to bring down their infection rates. And I know our good friend Mark Drakeford, First Minister of Wales, has had to order a lockdown in Wales. So yes, we do take this on board. It's one of the reasons why we are having a review, because we have to decide, given the situation the United Kingdom and Ireland and Northern Ireland find themselves in, that we may have to make changes, and we are waiting for that report. But I'm more than happy to confirm that those changes that may be made will be the whole household having to lock down. But we will have to wait until we get the evidence. But yes, it's something we constantly look at. I've written down here Ireland. Could the honourable member remind me what the question was regarding Ireland?
It was that they're going into lockdown, and if the UK went into a similar lockdown.
Right. Yes, well obviously, if our residents want to come back, when we had a problem that the UK was insisting that people flying into the UK had to quarantine for 14 days, we clarified, Mr. President, that Manx residents would not be impacted by that. They would be able to go to Heysham or the plane as long as they had leave to come to the island, and as long as they went straight there to get back to the island, they wouldn't be forced to stay there for 14 days before they came back. So I would obviously, if the United Kingdom decided to go into full lockdown, which may happen, who knows, I would have thought half-term when the schools are shut, that might be the time they do it, if they do it, and I'm not privy to any knowledge, I hasten to add. But obviously I would be contacting my UK counterparts to ensure that Manx residents were not trapped there, as long as there was a clear undertaking that the Manx resident came straight home and didn't go viewing castles or tourist hotspots. Thank you.
Honourable Member Mr. Robertshaw.
Thank you, Mr. President. My final question. In the light of the very concerning email that my colleague and friend in Douglas East alluded to with regard to the communication between the Director of Public Health and the Council of Ministers, and also in the light of his previous answer to me, can he absolutely assure me now that we will be able to access the Director of Public Health's opinion both on shielding and 7 days, and that there's nothing secretive about this? The clue is in the name, the title, Public Health. The public need to know these things. Can he assure me that members will have full access to the advice that the Director of Public Health is giving to the Council of Ministers? Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. I'll obviously have to take advice on this, that I can share the information. If that's something I can do, then yes, I will do. And I also hope to see the email, if the Honourable Member from Douglas East will share the email with me, because I'm rather surprised to hear that the Director of Public Health has said they've had no impact when they sit in the Council of Ministers giving advice and answering questions, and they've attended all the meetings. So I find that very strange, and whether it's just a simple misunderstanding between the two email writers, we'll have to see.
Honourable Member for Douglas Central, Mr. Thomas.
Thank you, Mr. President. In response to Mrs. Corlett's question, the Chief Minister referenced the fact that a policy paper was being received after the decision in respect of 7-day testing. Why wasn't there a policy paper, given the explanation that the Chief Minister has given, before the decision was made about 7 testing? People are saying, and I'd like the Chief Minister to answer this please, that the Chief Minister made that decision, it wasn't Council of Ministers. The second question is about, building on Mr. Robertshaw's question, public health advice is for the public. The Public Health Director exists for the public, not to provide advice to the Council of Ministers, to 9 people. Can the Chief Minister comment on that? And thirdly, does the Chief Minister disagree with the explanation by the Minister for Health and Social Care in August in a written answer to me, that in actual fact the advice given by the Senior Clinical and Public Health Advisory Group is passed up and discussed in a variety of different groups through the command structure in the department, and then only the final departmental position is then presented to the Chief Minister of a Council of Ministers via the Chief Executive for the department, which seems to be in contradiction to what the Chief Minister is outlining today.
Chief Minister.
Thank you, Mr. President. I'll try and cover all those. I think I've already indicated to the Honourable Member for Douglas East that if I'm advised there's no reason why I can't share, then of course I will share. So I've already given that. But when you're sharing Council of Ministers information, I have to just put that caveat in, that there's nothing I can't do there. Regarding 7-day testing, I think I've said we moved, and I would love to think that the Chief Minister can dictate to Council of Ministers what to do. There are many things I would have got my way in. Sadly, I haven't always, and it is a majority decision that works in the Council of Ministers. It will always work. The vast majority of the times, I hasten to add, we are totally united, but from time to time we do have differences of opinion, as all members in this honourable court do. We are, after all, independent. So, no, there's nothing that I personally can change. I have to debate it in the Council of Ministers, and if enough ministers agree with my view on certain things, then that's what goes forward, Mr. President. If they don't, it doesn't go forward. And as I say, we are having a paper to decide whether we need to amend our borders or the rules and regulations regarding our own people going off Ireland and coming back, given the seriousness of the increase in the United Kingdom.
Honourable Member for Onken, Miss Edge.
Thank you, Mr. President. I've got three questions for the Chief Minister with regards to medical advice to patients who have a COVID test prior to going into Nobles Hospital, and the advice is that they have to isolate, but they mix with their families and their families can go out to work. Can the Chief Minister comment on this and what the recommendation from Public Health is, or is this putting the NHS at risk, the fact that somebody that's had a COVID test prior to going to Nobles can continue to mix with their family and go out into the community? My second question for the Chief Minister is, he stated that discussions take place with regards to the potential economic impact. So do his plans get discussed with the Economic Recovery Group, and what are their views? And finally, the Chief Minister's just said that he is receiving a paper on Thursday. I'm just wondering, is the Chief Minister aware of who's been involved in the writing of that paper? Thank you, Mr. President.
Chief Minister.
Thank you, Mr. President. Regarding the last point first, I should imagine we're the usual group of people who advise the Council of Ministers on making changes. The Director of Public Health, the executive team in health and social care, medical advice, our police, on capacity, etc. It's the standard team that will give us advice. Regarding the department, whether committees on the Department for Enterprise are involved. I think I mentioned that workshops were led by the Department for Enterprise, of which both the Silver Command groups and clinical advisory groups were in attendance. I was not in that workshop, and therefore I cannot tell the honourable member who else from the Department for Enterprise was involved, but again I will ask to see what the full attendance was of that meeting. Now, regarding COVID tests re the hospital, if memory serves me correct, and I do sound to be corrected, I think it was the General Medical Council who insisted that tests had to be done prior to anyone going into Nobles Hospital, even though we don't have any COVID cases in the community. That was their request. And I'm led to believe, because I haven't had a complaint from anyone, although to the contrary, that what we are doing is complying with the General Medical Council's request to protect their members. Thank you, Mr. President.
Honourable Member for Council, Mrs. Lord Brennan.
Thank you, Mr. President. I think what members are trying to get to is how is Council Ministers making their decisions. So would the Chief Minister still attach importance to the Sir Jonathan Michael review, which specifically cautions against political interference, raises the importance of data and emphasises the importance of public health? Does he still see those conclusions and that report as being relevant in this pandemic? Why has the pandemic influenza plan that was updated in February 2020 been dropped, which emphasises that Cabinet Office will work with Public Health to decide and deliver key messages and communications? And in light of the number of questions, does the Chief Minister think it would be helpful, in the interests of transparency and confidence, to revisit the structure in terms of the COVID response from government? Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. So unusual points there. I'm surprised that the honourable member feels that politicians shouldn't have any input in dealing with a national crisis, that it should be purely medical. That's what the honourable member raised as there shouldn't be political interference with the Sir Jonathan Michaels. That's what you just read out. That's not the case with COVID. This is a crisis where the Council of Ministers, as government, has to make decisions based on the evidence from our medics, from our public health, but also from members of the public, the police, business community, because at the end of the day we have to steer our island through this dreadful pandemic to ensure that we protect of life. The protection of life is number one, obviously, but equally we can't have a situation where we've protected everyone's lives but we've allowed the economy to tank. And these are all really tough decisions that the Council of Ministers takes based on the evidence from a number of areas. And I've already read out some of the items that we consider, the factors, the wide range of factors that help us inform any decision going forward. Public health will lead. I don't think public health has given video interviews with the public and statements and advice. Public health is involved in Council of Ministers discussions where the Council of Ministers are able to ask the Director of Public Health, and public health is part of the process of building up the papers towards the advice given to the Council of Ministers. So I really am at a loss to see why honourable members are going down this route, that they feel public health has not been involved in going forward with COVID, whereas clearly they have played in their advice to honourable members a key part.
Honourable members, I'm taking two further supplementary questions. First from Mrs Barber, and then the final question from Mr Shimmons. Mrs Barber.
Thank you, Mr President. I wonder if the Chief Minister could advise us what the UK infection rate per 100,000 was when the decision was made to permit a swab at day 7 of isolation, and what the UK infection rate per 100,000 when the decision was made to withdraw that option.
Chief Minister.
Thank you, Mr President. I haven't got the exact figures with me. I'm more than happy to get the exact figures and share that with honourable members. I'm pretty certain it would be around the 70, 80, as I mentioned earlier, when we made that decision, and now when we changed it, it was around, and we look at the northwest, you know, if you look at our friends and colleagues in Guernsey, their area that they travel through is 10 times less the infection rate than the area that our people are going through in the northwest, Liverpool and Manchester. So it was circa 460 cases per 100,000 then, recently, and before it would be about 70, but I will get the exact figures for the honourable member.
Honourable Member Mr Shimmons.
Thank you, Mr President. I'm sure the Chief Minister will be aware that yesterday Sir Patrick Vallance, the UK Government's Chief Scientific Advisor, advised that any vaccine was unlikely to eradicate COVID and it was likely to become endemic in the population. Will the Chief Minister take account of this expert advice when considering the Isle of Man border strategy?
Chief Minister.
Thank you, Mr President. And yes, we take on lots of information, and I'm sure Sir Patrick Vallance's comments will be factored in by our medics when they're giving us the advice. No one, but maybe the exception of Dr Allenson, are medically qualified in the Council of Ministers, and therefore we do rely heavily on the advice given to us by our medics. But Sir Patrick Vallance's comments and the quality of the vaccine when it appears, I don't think we'll see much of it before April of next year, but we will have to, we're going to be living with COVID-19, and if it mutates for a long, long time, it's not something that's going to go away. We'll be living with this for years, and we will have to base our policies going forward on that factor. And as I'm saying in a later date, without giving too much of my speech away, we can't keep our borders closed forever, Mr President, but I think for the time being, whilst the vaccines are being developed and we gain a greater knowledge, we stay on the course where we are at this moment in time.
I'll call Miss August Hanson, who had caught my eye earlier. Honourable Member for Council, supplementary.
Thank you, Mr. President. Noticing that obviously there's more than just me in this court that is concerned and would like to see more information that is prompting Council of Ministers' decision and understanding the Chief Minister's position in that, would he consider committing to have a look at what advice that is provided to the Council of Ministers may become available to members, what may or may not become available to members, and have a review of that. And just in that understanding that obviously Tynwald also has decisions to make in this court regarding legislation and such the like to do with COVID-19 and our approach to it, and that of course steering the island through as he described it, and is quite right to, this dreadful pandemic, is not just the responsibility of the Council of Ministers, but the responsibility of every member of this court. Thank you, Mr. President.
Chief Minister to reply.
Thank you, Mr. President. Yes, I've always said I'm trying to be as open and frank with honourable members as possible, and any information I can share, I'm more than happy to share. But equally, I have to respect that when officers write a paper, if they think they can do it without it being shared everywhere, then they may be more candid with us. So it's getting that balance right. I would also like to point out that I think the Director of Public Health gave evidence to 2 or 3 committees regarding the outcome and advice, etc., on COVID-19, Mr. President, a few months ago. So they've also had impact to Tynwald members there with their views, as well as to the Council of Ministers. But yes, if I can share information, I'm more than happy to.